Hey guys, Don here. Welcome to the $1 Million Minute, going over kind of what helped bring to the $1 million mark and beyond. So this is day number 2 of our training for our ModMed. It's going well. Today we went over like post-op, wound care, fracture codes, and things like that. So these are some things I've noticed. The big difference between Athena and ModMed is this is really podiatry-specific. There's a lot of like wound codes with all the details that are needed for getting things covered, and also for getting like the grafts covered, and as well some of the like collagen. So a lot of these things we learned in the training for example, the Marigel collagen kits had to all be in your note, and I had to make up my own templates. The nice thing about ModMed is that it has all these templates that are made. We're gonna have to modify some things, but it works really well. It's a lot of clicking, which that's the one kind of the downside. It's a lot of clicking for Morali as I'm teaching him. So the thought is Morali is my scribe. I'm going to try to teach him, but I have to learn it too. So I'm going to have to learn it first so I can teach him. So it was good. The training was better today, I think mostly because I didn't have a carb overload like I did the day before. Okay, so today I'm recording from a Tuesday, 14 patients, 20 minutes that were open. But that was actually filled up, that 20-minute slot that was open. And so not as many patients as you can notice, because we had to reduce a little bit. We started our training these 3 days. It was going to be at 7 a.m. till about 10 a.m. That's when our training is. Okay, first patient. She's a patient that was back, 31-year-old. I did surgery on her in 2019. She had an arthroplasty in digits 3 and 4. Now the fourth one is kind of rotated, kind of a varus rotation, and she's walking on the lateral side of the toe. We got x-rays today. I gave her a crest pad to try to lift up the toe a little bit. I was considering either doing a flexor tenotomy or a derotational like skin plasty, possibly taking out some bone. So that's kind of what we're going to be planning on doing for her, just because it bothers her. Got an x-ray for that patient. Next patient was number 4 out of 6. She has plantar fascial pain. She's starting to feel better at Shockwave number 4. Next patient is a 65-year-old for a nail fungus follow-up. She ended up getting the fungus kit, and so that medication management. Next patient would be a Matrixectomy, a little 14-year-old. Had a possibly ingrown toenail. I asked them why they came to see us, because they had seen another provider like 3 or 4 times, and it was because the other doctor didn't offer a matrixectomy. That's why they came to see us here. Next patient was a EPAT number 3. She only did 3 of 3. I'm not sure. I think this was before I started offering the 6 of them, or she only wanted 3. So I did 3, and then she's going to come back in 6 weeks. So I did an office visit because it was the last one, and I planned kind of what would be next for her. Next patient was a patient they added on. She was one that I did an exostectomy about 5 or 6 days ago on the medial 5th digit. It was really swollen, and there was some drainage. I think it was just from the aggressive like grinding down or filing down with the rasp in that medial 5th digit for that exostosis. No signs of infection, but there was a little redness, and since she was concerned, I put her on an antibiotic just to be on the safe side. Next patient was a patient that came in for an ingrown toenail, but really he just somehow snuck in. It was a routine care patient. Next patient was a number 4 out of 6 Shockwave patient, 76-year-old. Next patient was another patient that had bilateral ingrown toenails, so I did bilateral INDs on the lateral aspect. And then he had routine care as well, a 57-year-old. Next was EPAT number 2. One was added on. There was a patient with a possible cyst in the proximal to the plantar second met head. This cyst, I'm not sure if it was a cyst. It was hypoechoic. I tried to aspirate it, or tried to pop it, and then I didn't get much out. I got a little bit of blood, and then I injected with cortisone. So I'm not sure what's going to happen there. I said if it happened again, we did it like 2 years ago. If it happens again, we'll probably get an MRI. Next patient was number 4 out of 6 with a Shockwave for plantar fasciitis. He also got his orthotics dispensed to him today. Next patient was a 48-year-old. She had a left ankle fracture about 2 years ago. Since then, she's been trying to get more active. Her husband's very active, does marathons and a lot of activities, and so she wanted to start doing things with him, but then unfortunately her ankle has been hurting her and her foot. So she has pain to the anterior ankle joint and also the subtalar joint. I did 1.5 cc's in each with a cortisone injection, and I also scanned her for orthotics because she had a lot of pain after standing long periods of time. So we'll see how she does with the orthotics and the cortisone injections we talked about, possibly doing also Shockwave or taking out the hardware that's in her ankle. Next patient was a patient with bunion pain. We just did x-rays. We talked about kind of bunion surgery and different types of treatments. And then the last one of the day was a patient that needed a bilateral partial nail avulsion on the medial hallux. She also had a positive nail culture for a mold, so I did itraconazole for her. Or I'm going to be doing that for her in 2 months. She's going on vacation, so I'm going to have her get through her vacation. I'm going to see her back in 2 months, and we're going to order that Sporanox for her. Anyway, that was the day. Kind of not as many patients. The training is going well. I think you'll see yesterday I put in my my one-page review, which I like to do each month. So hopefully that'll kind of let you know kind of what's going on in the practice. Hope you guys find this beneficial. If you are wanting more help, shoot me an email down at podiatry-practice-mastery.com. Would love to help with any questions you have. If I can help you, I'd be happy to do so. Okay, thanks.